Uh, it is indeed a great pleasure to have such an opportunity to share my perspectives concerning uh, this international conference, where we share lots of ideas and listen, even take part in the presentations and see what other researchers are doing in order to build our own uh, practice. Yes, the theme is emerging trends and advances in management, law, humanities, and social sciences. That is the Global Nexus 2025. Building on the presentation of the previous speaker, I want to make a case for systematic reviews and policy practice. That is the nexus between systematic reviews and policy practice. How do we, as researchers here present, bridge evidence and decision making? It is an area that I thought that it is our niche as emerging researchers, established researchers, in the sense that not everyone has the opportunity to work in a laboratory due to the nature of their discipline, but research must go on. So I am making a case here where we will discuss the critical nexus between systematic reviews and policy practice. We will explore how robust and transparent research methodologies can directly influence and improve policymaking processes, which is our niche, those of us that do not work in laboratory situations. So let's dive into how these domains connect and create a powerful synergy for evidence-based decisions. Let me once again reiterate that I am hoping that we can look at a research niche that can be a life-changing moment for those that do not have access, for example, to laboratory infrastructure. How are we going to do this? The context here is evidence-based policy, a growing necessity. Here I'm just signposting. Bridging academic research and policy decision-making. The role now of systematic reviews in synthesizing this evidence. So, in an era where evidence-based decisions are more crucial than ever, there is a clear need to bridge the gap between academic research and policy implementation. Systematic reviews, therefore, will serve as a rigorous method to compile and analyze research findings, ensuring that policy decisions are informed by a comprehensive and balanced body of evidence. Hence, my case, where we are saying, how can we as researchers leverage on being part of being a cog in the system, in this big machine, so as to do our research, pass it on to those that need to implement our recommendations by way of decision making in an informed sense. So, how do these reviews serve as the cornerstone for effective policy making? Here, let's revisit again what are systematic reviews. These are methodical, comprehensive reviews of the literature that aim to collect, critically evaluate, and synthesize research evidence. Synthesizing being the keyword here, because then that is what we will be presenting to those that will be our implementers in this whole chain. So unlike narrative reviews that can be subjective Systematic reviews follow a predefined protocol which enhances their credibility and replicability. So this rigorous approach is the one that ensures that conclusions are based on a balanced appraisal of all available evidence. So, understanding policy practice? Yes, because we are looking at the nexus here. Evidence-based policy making defined, integration of research into decision making, where it goes our role as researchers, real world implications and outcomes. Policy practice here involves the process by which governments and organizations will make decisions that affect us, the public. So the modern trend is to rely on solid empirical evidence when formulating policies. This ensures that decisions are both effective and justifiable, not populist. So, how does research, particularly in systematic reviews, provide the backbone for these evidence-based decisions, ultimately influencing outcomes in areas such as public health, environmental management, governance, and social policy? There goes our niche again. How can researchers involve themselves through systematic reviews? There is a need for a nexus. Here we see that policy making, research needs to be a symbiotic. There needs to be a symbiotic relationship. So the evidence to policy gap, we will look at that. Why is there such an evidence to policy gap, and how can researchers come in? Challenges in translating the complex research into policy, because people are elected into positions of authority, not necessarily because they are academicians or academics, or they will understand our research outputs at first sight. But there are opportunities for aligning systematic reviews with policy objectives. So, despite this availability of research, there often exists an evidence to policy gap where the insights from research do not seamlessly translate into policy actions. This disconnect can arise from various factors, some of which include communication barriers, differing timelines, and the complexity of the research findings. How do we break it down so that policymakers can make meaning? So, establishing a strong nexus between systematic reviews and policy practice is therefore essential to bridge this gap and ensure that policy is both informed by and reflective of the best available evidence. There is our niche, again, as researchers, to say our role now is clear, is clearly defined here, because we come in through systematic reviews. This is a policy tool in a way, because we will talk about aggregation and synthesis of diverse studies. This informs debates and policy choices, providing a balanced perspective on issues. Systematic reviews, as we know, will aggregate, will put together data from multiple studies, allowing policymakers, therefore, to see the full picture rather than isolated findings that may be even contradicting. So, by synthesizing evidence from various sources, these reviews help inform debates, and support decisions with a solid empirical foundation. They enable us to identify best practices and effective interventions that might otherwise be obscured by conflicting individuals' studies or stories or output or outcomes as performed by different individuals. So, another case or another point about these systematic reviews is the methodological rigor and transparency, where simply because of standardized protocol, whether it's protocol development, data extraction, quality assessment of these sources, this minimizes bias and increases trust. Transparency as a pillar of credibility. Therefore, this rigorous methodology behind systematic reviews, including defined protocols, systematic data extraction, and quality assurance, helps minimize bias and therefore enhances reliability. This transparency not only builds trust among the research community, but also policymakers who require a clear, unbiased evidence to justify their decisions. So, how do we translate? Translating evidence for policy impact. So we are saying from research synthesis to actionable insights, identifying best practices and key interventions. We can look at some real-world examples where there's been a policy change that has been informed by systematic review. One of the most critical steps is translating this synthesized evidence into actionable policy recommendations. This process will involve distilling complex data into clear, precise, and concise messages that guide policy interventions. So, for example, systematic reviews in public health have directly informed vaccination policies, polio, COVID-19, most recently, by identifying effective strategies to boost immunization rates, for example. Now, how then do we bridge this gap? What are the challenges to be aware of? Yes, communication is number one. Communication barriers between researchers and policy makers, timelines and complexity of systematic reviews, and then accessibility of technical findings from, for non-specialist audiences, because these are people in parliament, these are people in offices who may not be specialists in the area of research. So while the potential of systematic reviews in policy is huge, there are challenges such as the communication gap, where the language of academia can be technical and therefore inaccessible for policymakers. Additionally, the time-consuming nature of systematic reviews may not always align with the rapid decision-making cycles in policy. So that's one of those challenges that we need to be aware of. So addressing these challenges is key to enhancing this nexus. So how do we do that? What are the strategies to strengthen the nexus? We are fostering interdisciplinary collaboration. We engage policymakers early in the review process, and we enhance dissemination and communication of findings, just like in this international conference. It's one way of disseminating and filtering the communication of the findings to a larger audience. So we must adopt several strategies in order to mitigate these challenges. First, by fostering interdisciplinary collaboration, which can help bridge the language and cultural differences between researchers and policymakers. We can also engage policymakers early in the review process, ensuring that the research addresses relevant policy questions. And lastly, but not least, improving the way the findings are communicated, that is through summaries, policy briefs, and interactive platforms, can make a significant difference in their impact. What is the role of stakeholders in this nexus? Inclusion of diverse stakeholders. In this conference, there are so many collaborative actions that we have noted. Academics, practitioners, and probably policymakers are here present. So that's one way we are going to look at it. Then there's co-production of research and policy solutions, something that refers to collaboration. And then also enhancing accountability and transparency to build trust. So stakeholder engagement is critical for a robust evidence to policy nexus. When academics, practitioners, and the policymakers collaborate from the outset, it creates a co-production model that enhances accountability and will ensure that research is directly relevant to the policy needs. So this collaborative approach not only improves the quality of evidence, but also facilitates smoother policy implementation. Having said that, what are the implications, therefore, for future research? Aligning research priorities with policy needs. This research must look at addressing a need in improving policy. Develop innovative methodologies for rapid synthesis of these available knowledge. Integrate implementation science into systematic reviews. So looking forward, future research must evolve to better serve policy needs. This involves aligning research priorities with the urgent questions faced by policymakers. That means the researchers must be on the lookout, developing innovative and faster synthesis methods. Now we have AI that can assist in, for example, identifying the sources, identifying research, pertinent research to the research question, and incorporating elements of implementation science into the systematic reviews. This will therefore ensure that research not only informs, but also accelerates effective policy making. That also prioritizes, gives importance to researchers carrying out systematic review. Looking at policy recommendations, we can think about embedding systematic reviews into the policy development cycle. We can establish standardized guidelines for evidence-based policymaking. Before a policy can be discussed, it has to go through all the phases, one of which will be systematic reviews. Promote continuous dialogue between researchers and decision makers. Yes, based on our discussion, several policy recommendations will emerge, such as 1. Systematic reviews should become an integral part of the policy development cycle. We need standardized guidelines that ensure all policies are supported by robust evidence. Furthermore, continuous dialogue between researchers and policymakers must be encouraged in order to keep the feedback loop open and dynamic, open and in motion. So, in conclusion, the nexus between systematic reviews and policy practice holds great transformative potential. By ensuring that policy decisions are informed by rigorous, transparent evidence, we can significantly enhance the effectiveness of public policies. This could be at institutional level, at university level, where we are looking at improving student wellness, for example. We need to go and look at what policies do we want to put in place. What is the evidence to support that policy change? You will see that it becomes a very balanced kind of policy. Why? Because it is informed by systematic reviews, and these systematic reviews are done by us as researchers. So my case here is that I urge all of you, whether you are graduate, postgraduate, postdoc, or academician, to advocate for and engage in practices that bridge this gap. Therefore, I want to encourage my colleagues here to say, as researchers, can we take this opportunity to look at that area where we are looking at forming a collaboration, collaborative groups that can look at systematic reviews as an easy way of carrying out our research, but also contributing to policy changes for the good of the public. I appreciate your attention and thank you very much. May I wish that we have a productive 2 days of research deliberations. Thank you once again.